I appreciate the opportunity to appear on behalf of the National Partnership for Women and Families. We are a policy and legal advocacy group that has worked for more than 50 years to improve women's lives and to ensure that gender is never a barrier to anyone's opportunities or success. We believe that guaranteeing meaningful access to reproductive health care, including abortion care, is a vital part of creating a quality, reliable system of health care that extends throughout a person's life. Access to abortion is essential health care and should be clearly understood as a basic human right, because reproductive freedom is fundamental to upholding the individual autonomy of all women and their ability to control their own bodies. The overturning of Roe v. Wade has been devastating and chaotic for both patients and our healthcare system. When we consider all the states with severe abortion restrictions in place or pending, more than 36 million women of reproductive age are either currently banned or likely to be banned from accessing abortion in the states where they live. This means more and more people must travel further to access care. No one should have to travel to get the health care that they need or face additional burdens if travel is their only option. In some states, lawmakers have contemplated or tried to enact policies that would effectively prohibit residents from crossing state lines to receive abortion care. These efforts are highly problematic, inconsistent with longstanding constitutional protections and Supreme Court precedent, and would bring even more disruption to our healthcare system. The new healthcare landscape and the lack of abortion access has already erected hurdles to obtaining care. Some providers have stopped practicing in certain states, while some hospitals have been forced to cut back services in their maternity units or even close them entirely. Nearly 1 in 3 counties in the U.S. is now considered a maternity care desert, meaning they lack access to a hospital maternity care facility, a birth center, an OBGYN, or a certified nurse midwife. Some providers report that patients must now wait 3 months to receive prenatal visits or ultrasound appointments and sacrifice their time, money, and job security to travel for care. This occurs while maternal health rates in our country already lag far behind many industrialized nations. The maternal health crisis is especially severe among Black and Indigenous women, as maternal mortality rates are 3 times higher among Black women than white women. Abortion restrictions only deepen the inequities in our healthcare system. The costs of traveling for care are significant. They can include gas, food, hotels, taking time from work, or losing a job altogether, and childcare or caregiving costs while a patient is away. These costs often fall on those who can least afford them. Research shows that people who must travel the farthest to access abortion care also tend to earn less income. For example, of the nearly 7 million Black women of reproductive age living in states that have banned or are likely to ban abortion, nearly 3 million of them are economically insecure. The economic hardships now having to travel for care could put the care that they need essentially out of reach. Travel bans also create steep hurdles for disabled women who may need to navigate mobility challenges and to bear the added expense imposed by accessible transportation services when trying to secure abortion care. These efforts to control women's bodies, their choices, their opportunities, and their trajectories in life are not new. The willingness to take away individual freedom and access to abortion, often imposed by people who are disconnected from their lives, is not fair. And too often it is rooted in longstanding stereotypes about gender roles and responsibilities, race and gender bias, and whether women can participate fully and equally in society and chart their own course. Any woman, indeed any person, should have the right to travel for health care, and this right to travel must be protected to ensure that all people can access essential care whenever they need it. I'm grateful for the chance to speak with you today and happy to answer your questions.